one of the most popular forms of testing is now called PGT-A. So instead of PGT, preimplantation genetic diagnosis, now all this genetic testing is called PGT, which stands for preimplantation genetic testing. So in addition to the PGT-A that checks the chromosomes of the embryo, there are other forms of preimplantation genetic testing that check for other things. So we have PGT-M, and M stands for monogenic disorders. So these are mutations in a single gene. So we're not really looking at the whole chromosome number. Now we're looking at a mutation in a gene, in one gene. So perhaps in one letter in the DNA code that can result in a baby affected by a disease. Now, in this case, this PGT-M is indicated for couples that are at risk for having a child affected with a genetic disorder. To be at risk, one of them or both of them have to carry that mutation in their own DNA, and therefore we can test the embryos to make sure that we choose one that doesn't have the mutation for that particular disease. So one big difference is PGT-A can be applied to all the patients that are doing in vitro fertilization to check for the chromosomes of their embryos. PGT-M is only for couples that are at risk for a particular single gene disorder. And there is a third form of PGT, and it's called PGT-SR. So SR stands for structural rearrangements. So these are also more individualized cases. There are patients that have some rearrangements in their own chromosomes, so one of the parents, that typically result in miscarriages. So these patients can benefit from this specific form of PGT-SR that will identify embryos that are okay to be implanted to prevent further miscarriages. And because the technology continues to change very rapidly, there is one new addition now is the PGT-AI, and AI stands for artificial intelligence. The nice thing about the artificial intelligence is that now the technology utilizes some fancy algorithms to be able to determine if the chromosomes in the embryo are normal or abnormal. So instead of having one person looking at the computer results and deciding, now machine learning algorithms are doing the job, and so far the data shows that they are much better at making this diagnosis.